Because preventive medicine is the center of the medical specialty because there's no profit in health. But actually, with all that criticism and problem over the last 51 years, it's been amazing to see what happened. One of the amazing things that did happen was when I was asked September 11th, back in 2019, to speak before Members United Nations, UNESCO. It's first time to be the Coalition for Better Health and Lower Costs in supporting their number 3 to provide well-being, provide health, ensure healthy lives, and promote well-being for all ages. And that's exactly what I've been trying to do over the years. Because the title of the presentation was, it's more beneficial and cost-effective to prevent disease than to find a cure. We spent over $2 billion trying to find a cure for Alzheimer's. In this presentation, I'll show you some amazing results we've had with a 25-year follow-up on patients who became fit and what happened as far as the incidence of Alzheimer's and dementia. Also, we'll be talking about the role of vitamin D, how important that is as far as COVID, particular people of color. It all started back in 1968 when the first book of aerobics was published. It was published both in hardback and softback form at the same time, March 1968. But I want to get this message around the world. It is a result of some 4 years of research in the Air Force with 27,000 people, 15,000 exercises, 12,000 controls at 5 Air Force bases. We actually developed the aerobic point system, determining how much exercise is necessary to get benefits, prolonging life, reducing death small causes. All this was all speculative back in the early days, but we have so much data now, you can't deny that exercise is medicine. Also, what sent the book worldwide was the Reader's Digest. They had tear off of promotion of my book, the first book, and then the second book to do aerobics. It all happened in 1968. But yet the critics were there, saying there's been these fads and they're transient things, and people just don't continue exercise programs, it won't last. But what happened? Back in 1968, we had less than 24% of our adult population exercising, less than 100,000 joggers. I want you to know I ran the Boston Marathon back in 1962. I placed 101st in the Boston Marathon. Sounds fantastic. Only 150 people running back in those days. In 1990, we had 40% exercising, 30 million people that were jogging regularly. Latest figure, 2017, still have almost 56 million people jogging in America today. But also we had the critics that said the streets going to be full of dead joggers. I was seeing titles in medical newspaper articles that the streets going to be full of dead joggers, so people try to follow this Cooper method. It's going to be dangerous. They shouldn't do that. But what happened? Deaths from coronary heart disease between 1960 and 1990 dropped 48%. Highest in the world, only 3 countries had a comparable statistic: Australia, Canada, and New Zealand. But most of the people that attended this presentation, United Nations, both were ambassadors, about 150 people were there, came from foreign countries, of course, all over the world. I pointed out where we went down that period of time, they went up. For example, in Russia, there's a 31% increase. In Poland, 36% increase. In Hungary, 40% increase. And the record was Romania with a 60% increase. Sure, Dr. Cooper, that's happened around the world, but has happened in Europe, but not around the world. But there was no question about having that decrease of 48% during that first part of this presentation. Deaths from coronary heart disease, heart attacks, and the consequences, clogged arteries, peaked 1968, it's an NHLI. That's an I said that at the bottom. The initial decline was so steep, there it was, the critics. It was hard for some scientists to believe that could occur. After much debate, the decision that it was real. Well, it's because Americans changed their lifestyle because of modern technology. Look at that. That 48% death, only 33% because of medical technology. Back in 1968, 1990, we didn't have any angioplasty and stents, very few during that day. We didn't have the emphasis on statin drugs until the late 1990s. So something else happened during that time that accounted for that 48% decrease, and it was lifestyle. Who did it? Baby boomers. 76 million people born between 1946 and 1964 led a health revolution we've never seen before, and it came to an end, as you'll see, by 1990. What did they do? They quit smoking great numbers. We dropped from 46% down to 27% during that period of time. Blood pressure control went from 15% to 55% during that time. Cholesterol reduction. Middle-aged American male dropped his total cholesterol from 234 to 204 during that period of time. Heart affects and stress and how to control it. I'm reminded of what Hans Selye once said: the stress is the spice of life. What would life be like? There's no runs, no hits, and no errors. Here I'm 90 years of age, exercise every day before I go home. 10, 12 hours at the office, still doing that, is so I can burn up the stress so I can sleep at night. And exercise is a very way to control the stress in your life. One of my 19 books was entitled Can Stress Heal? Stress Can Kill. but stress can also heal. And also remember too, the most common manifestation of obesity is stress. And it relates to obesity. I'll tell you about that in a few minutes. And then finally, increased physical activity. Look at that in reverse. What's the best way to control stress physiologically? Exercise in a stressful day. What's the best way to improve the good cholesterol, the HDL cholesterol? Is aerobic exercise. What's the best way to prevent hypertension, even treat hypertension? Aerobic exercise. And what's the best way to break the cigarette smoking habit permanently? Is start an exercise program. If you give up cigarette smoking, you don't give it up, you have to replace it with something. Or replace it with exercise is one way we can resolve that problem. All right, and what happened though? By 2000, you see that this is probably in 2019, heart disease progressed, stalls to stagnation. You see that drop off in 1960, but it's flattened out the last few years, as you can see. Why would that occur? Because younger people and women are more often stricken. And death rates from cardiovascular disease has dropped only 4% since 2011, 7% since the 1960s, because obesity and diabetes have stalled the decline. In 1990, we had only 33% of our adults overweight and obese, above 25 on the BMI scale. That figure's now 70%. In 1990, we had some 13% of our children overweight and obese. That's now 36%. We've had a diabetes or obesity epidemic that's occurred since 1990 that has changed statistics over the last year and a half. We've seen a decrease in longevity. They say because of the opioid epidemic? I think it's because of the obesity and diabetes epidemic we have in America. All right, let's look at this. We had a Cooper Institute Medicare study. They followed 28,000 people, 20% women, who came to the clinic between 49 and 50 years of age, and we followed for 25 years and got their Medicare data from 65 to 75 years of age. We only looked at one variable, looked at their level of fitness measured by time on the treadmill. You had to rank in the top 40 percentile, age and sex adjusted. Good exercise period category of fitness, compare those to very poor category of fitness. And what did we find with that 25-year follow-up? The most amazing thing was published in 2013. Those people in the top category of fitness had 36% less Alzheimer's and dementia than those at the bottom. The only variable was exercise that we looked at. And we know what Alzheimer's dementia is doing around the world now. It's exploding. And it's something that has to get controlled. Now, why would that possibly have occurred? Why is there a relationship between exercise and reduction in Alzheimer's and dementia? I think one answer to that might be chronic inflammation. This is covered in Harvard Magazine back in 2019. They point out there's something physicians have been ignoring. They've been so concentrating on acute disease, they ignore the fact that chronic disease may be a factor in many diseases. Because you can have a brain full of amyloid plaque and tau protein, but it don't come down with the disease unless something activates it. And what apparently activates it is chronic inflammation. We measure that by the C-reactive protein. We measure this by the L6. So there's various things we can do, but physicians aren't looking at chronic inflammation. Well, I'm hoping from this presentation and now as a result of the success of the meeting of the United Nations, to quickly document my life. And one thing that we can get out of that is encourage the physicians of the world to start concentrating on something just acute disease and look at chronic inflammation. All right, now, what would that affect? Evidence has been mounting that chronic conditions, including Alzheimer's, cancer, arthritis, asthma, gout, psoriasis, anemia, multiple sclerosis, diabetes, depression, and Parkinsonism, are indeed triggered by long-term chronic inflammation. Published in Harvard, as you can tell. What's the cause of it? Oxidative stress, pollution. Processed foods, sugar, and refined carbohydrates. And the message for you as an international organization is inactivity and obesity. Because you see those people we fought for 25 years, they were lean and trim in that top category. Bottom category, overweight and inactive during that period of time. And so something as simple as controlling inactivity and obesity have a dramatic effect on reducing a major health problem in the world today is Alzheimer's. We also found in the Medicare study there was up to 40% less chronic kidney disease requiring dialysis. There was up to 40% less congestive heart failure. This all published in peer-reviewed scientific journals. We've got to start looking at chronic inflammation. I look at physical inactivity. The black states are the ones that have more than 30% are inactive. Look at obesity, Mississippi Valley, you can see. So we have an overwhelming problem with obesity and activity in America today, and particularly with our youth. With our fitness gram testing program, we started this back in 2008 here in the state of Texas. We started measuring the fitness and flexibility all for the children, using a shuttle run for the elementary schools, 1 mile walk run for middle school and high school, and we've seen changes. We've been seeing some changes as far as to stabilize the obesity problem in Texas and our children, increasing aerobic capacity. We also work with NFL, with their Play 60 program. We do the testing for them, 10 million people. We're finding the same thing. NFL has done more with their Play 60 program than anybody's done with the government in trying to improve the health of our children. Remember that an overweight child becomes an overweight adult, about 65% of the cases. All right, now having other things we need to consider as far as Alzheimer's dementia. This will be in the documentary. Engage the brain daily. I read extensively, keeping my mind active. Other things you can do, puzzles, learning new things, memorizing, improving computer skills. Because what is good for the heart is good for the brain. Exercise at least 30 minutes. That's our key. You don't have to run marathons or half marathons. The first key is just avoiding inactivity. One of published November the 3rd, 1989, the JMA was entitled Physical Fitness of All Cause Mortality. They classified a lot more so in the century, answering the question how much exercise is necessary. Because of the fitness scale, very poor to poor, fair, good and excellent, we found get people to move up in 8.6-year follow-up, 13,600 people. We had to move up one block on the fitness scale from very poor to poor. They reduced deaths from all causes by 58%, increasing life expectancy by 6 years. Well, at the end, those top category of fitness, only 9% increase in only 9-year increase in longevity, and 65% decrease in all-cause mortality. Just avoiding inactivity, 30 minutes, collective or sustained, most days per week, 150 minutes per week. We can show you results. So exercise, sleep, that's very important as far as reducing Alzheimer's dementia. Retirement, here I am, 90 years of age, still working 50 to 60 hours a week. I like what the famous motivational speakers, Zig Ziglar once said, you don't retire, you refire. Refire. That's what I'm trying to do in delaying retirement. Socialize, very important. Join a club, church, synagogue, group, or volunteer with an organization. Other steps, no tobacco use at any time. Nothing can be said good about tobacco use except getting rid of it. Use alcohol in moderation. I don't drink at all, but if you drink, you should limit your alcohol to no more than 1 drink a day or 6 or 7 drinks a week. Used to say men could have 2 a day or 14 a week, and women 1 a day or 7 a week. Big article came out in Lancet just last year, a big European study, and they pointed out that if men were to drink 14 drinks a week, they shorten the lifespan by 1.5 to 2 years. And we know that you can reduce cancer. The American Cancer Society is saying if you eliminate obesity, inactivity, and cigarette smoking, alcohol, you can drop cancer deaths by at least 50%. Why aren't we doing that? Why aren't we concentrating on that? They're still looking for the cure for cancer. Let's prevent it in the first place. And this is documented all the studies that we're seeing. And so going down the list there, let's do the alcohol in moderation. Healthy eating. My rule is 5 is fine, none is fine. That's the number of fruits and servings you should be eating on a daily basis. I start the day with 2 fruits. I end up with at least 5 servings of fruits and vegetables every day. And this is a very important part of my life. The Mediterranean diet is the best diet, no question about that. Vitamins, we're strong component of vitamin, particularly vitamin D, but we strongly recommend vitamin B12 and 2,000 units of vitamin D. I'll show you the importance of that in a few minutes. Then omega-3, very important. You control coronary risk factors. As I said, what is good for the heart is good for the brain. The thing that was most dramatic when I give this presentation in the United Nations is the cost of health care. From 65 to 75 years of age, in our people in the Medicare study, was 40% less. Those are the top category of fitness, measured by determined by the level of fitness, versus the bottom category, 40% less. You tell me anything that's been shown to reduce the cost of health care. You show me anything that's been shown to reduce the incidence of Alzheimer's and dementia, what I'm telling you is right now. So the message is finally getting out. There are things we can do for taking care of ourselves. All right, now we've been able to document people coming to us at least 20 times in the last 45 years and look at their longevity. Our people are squaring off the curve, living a long, healthy life the fullest, and then dying suddenly. And if I die, that's why I want to die. I've had a wonderful life. If I die tomorrow, I've had a fantastic life. But look what's happened. We're finding that the 32,000 women and the almost 73,000 men, 100,000 total, they're living 10 years longer than the national average. Our men are living right at 86.5 years. Our women are living 90.5 years. Can that happen? It can happen if you get Cooperized. Now, these are basic concepts here. Both of those I've already discussed. But number 1, body mass index should be under 25. Nutrition, at least 5 is fine, not as fine. Exercise, 30 minutes. Supplementation. We recommend at least 2,000 units of vitamin D and at least 3,000 milligrams of omega-3. I'm writing a series of articles in Decision Magazine. This is the Milligram Organization. I started this in January, and I've been overwhelmed with response on talking about what you can do for yourself, people around the world. It goes 8.5 million people. I'll talk about the importance of supplementation. We'll talk about it in a minute. Tobacco, not of any type. Drug, limit to no more than 7 per week, as I said, for either men or women. And control stress, exercise, meditation. And a comprehensive exam. You can't provide comprehensive examinations. We're working in China. We've had a standstill now because of COVID. We have a place in Nanjing, China. We have a facility there, the Cooper Aerobics Health and Wellness Center. We've been talking about in China having a series of places we can evaluate people in China by doing such simple things as getting your height and weight body mass index, and getting your blood pressure, and then getting a lipid profile, and then getting tests for diabetes, fasting blood sugar, hemoglobin A1C. It'll cost about $15 to $20 to do that. You can do that at your clubs. I don't know why we don't do that. You don't do that at your clubs because a simple thing that covers the majority of problems that we're having. Your blood pressure, height and weight, body mass index, and check the lipid profile, and then check for sugar diabetes is all you're doing. Very simple. It can be done with laboratory analysis, desktop analysis. We can do that. So we think that it is very important. But then, so the conference examination doesn't have to be the big expensive type examination we have in our clinic. We have over 150,000 patients in our database, over 300,000 credible stress tests, and over 1 million persons of follow-up from which our database is coming. Weeks later in Washington, D.C. with this fabulous database of 150,000 patients, and some followed for as long as 50 years, and 300,000 micro-performance credible stress tests. And they asked the question, how much did NIH pay for that? I said, nothing. We paid for it ourselves. Because the patients come into the clinic, they pay for examinations, we give the data to the Research Institute, we raise money for the data to be collected, analyzed, and published over 600 papers now, proving the value that exercise is medicine. So being Cooperized is something I've been trying to promote. The last time I was in China was in 2019. Just got back to Dallas for my host wanted me to come back to Beijing and speak to 300 top executives. I can't do that, I just got back, it's impossible. Could you send a video? So I sent a video, basically what I'm giving you today, a video for these people to see. But I ended up by saying, my hope and prayer is that 1.4 billion Chinese people will get Cooperized and live as long and healthy life as I'm living at 89 years of age. He said the next day, that went worldwide in China, all over the country, about the last statement. I'm expected to be banned from China because they don't believe in prayer and Christianity like we believe in this country. I've gone from ground zero to where we are present time over the last 51 years. I've said this following. The reason I've had this is number one, divine intervention. I'm very strong in my beliefs, and there's so many reasons why I shouldn't be here today. With more than half my medical school classes already died. And yet for some reason I've been kept alive. Hope we get this message around the world. Number two is a fantastic staff. Some of you have been to our center here in Dallas. We have a fantastic staff. We give great credit for our success. Any CEO is going to be just as successful as the staff makes it. Number three, we have proven super effective prevention is the finding cure. Number four, very important. If people realize that they have a need, you provide the service, they get the results they want, they'll make you successful. That's why 52% of our patients are corporate sponsored and 74% are return patients. They're getting what they want, they come back, they get their friends and they respect it. We don't have to advertise, but we're getting results. We got a formula here that is working well. The impact of healthy lifestyle. Somebody else has also shown you can prolong life, and that's Harvard School of Public Health with a nurse physician study. 78,000 nurses and 45,000 roughly physicians. They fought for 34 years. Look at their risk factors: never smoking, healthy weight, regular physical activity, healthy diet, moderate alcohol, about the same as ours. Those that had all those risk factors, women live 79 years, men 75.5 years. That's the average in America now. But those who eliminated all those risk factors, 93.1 years for women and 87.6 years for men. We have undeniable data that your lifestyle can prolong your life. The most unappreciated risk factor in mental health is more than 76% are preventable, and more than 45 to 50% of cancer preventable. And that very important point, that's one of my favorite statements. No drug can replicate the benefits of an active lifestyle. And the way to solve problems is empowering the people, not empowering the government. Now I want to shift gears for a moment and talk about vitamin D. I've been promoting this primarily by myself, but not going around the world. Because I started looking at this several years ago. Vitamin D, because vitamin D benefits, reduces inflammation, reduces autoimmunity, reduces cancer cell growth, improves brain function, improves mood and sleep, improves immune system, reduces the risk of heart disease. All that. Vitamin D plays an essential role in brain health. Vitamin D is critical during neonatal development. It's having an early deficiency. It's linked to multiple sclerosis. Schizophrenia, MS. Schizophrenia are all common individuals with that gene mutation. With this gene mutation, these people have vitamin D levels of 9, 10, or 11. We know if you'll find out in a minute, if your vitamin D level is less than 20, 76% increased risk of COVID. We know that. A lot of this is being ignored, but now it's getting a lot of attention at the present time. Vitamin D deficiencies, muscle weakness, rickets, insomnia, cognitive impairment, nearsightedness, improper bone function, weakness and thinning of bones, increased likelihood of becoming addicted to opioid drugs for treatment of pain. I brought this with me, an article just published this week in the Texas Medical Journal. Just 7 days of prescription opioid results can result in physical dependence. And the majority of people that have opioid dependence at the present time, it was iatrogenic caused by a physician. But only 7 days can increase the likelihood. Also, this was published this last June from Mass General, that if you have a low vitamin D level, like less than 20, that also, as I say, increases the likelihood of becoming addicted to opioid drugs for treatment of pain. I think you'll find in the future when you have elective surgical procedure, you get a vitamin D testing. And if your vitamin D level is at the level we think it should be, at least above 40, you're going to be delayed in putting some vitamin D before you go through elective surgery. That's what I'm hoping to get to keep this addiction problem under control. Ways to increase vitamin D as skin ages. Our bodies can handle only a certain amount of skin exposure a day as we get older. As skin ages, its capacity for vitamin D decreases. And supplementation is the only way that can happen, you can overcome that. And so this is what really piqued my interest, published in the British Medical Journal back in February 2017. Vitamin supplementation prevent acute respiratory tract infection. It found a perfect relationship. And what are people dying from COVID-19? They're dying of pneumonia, respiratory infection. So if there's some relationship there, and the vitamin D, when we start looking at that, that was published in 2017. And so this is published in myths and facts about vitamin D. Now, elderly people, African Americans, the problem with COVID-19 is just a virus, but that's what causes the problem. It's the body's response to the virus, called a cytokine storm. And the good Lord provided us with a means of suppressing that, and that is vitamin D. We know that now. African Americans are particularly vulnerable to that. And why do you think they have a 5 to 7-fold increase in hospitalization, 2-fold increased risk of death compared to people with lighter skin? That's the message. I'm writing an article with Decision Magazine, Disability Grant Organization. Wrote the first one back in January, talked about how God has had his hand on my life. But also I had an article, I had a vitamin on the importance of vitamin D. There were 8.5 million people around the world. You can believe the response I have people around the world. Well, why have we known this before? There's something as simple. You get 5,000 units of vitamin D on the line, it costs you a nickel a day. And use your vitamin D3 is what we strongly recommend. African Americans, patients with diabetes, relatives, chronic lung disease, all groups with low vitamin D. African Americans, I said, run the single digit to the low teens is what they usually run. And you get that's your very, very relevant problem, as you'll see in just a minute. And why do children not have the same problem that we have as adults? Because it's our immune systems are different. As we have repetitive types of infections, our immune system builds up in adults. And by the time we get hit with the coronavirus, then we have an overwhelming immune response. Now, kids aren't at that level because they haven't had the numbers of infections we've had, and their immune positions down here, and their response is very minimal. That's why they have less than 1% of those kids are dying. That's what I've been told from COVID-19. So it's something different physiologically that's in our immune system. We need to be aware of that. What about vitamin D, the prevention of coronavirus diseases and aerobic infection? That was published in 2020. And the mean level of vitamin D was 22. Vitamin D levels are severely low in the aging population, especially in Spain, Italy, and Switzerland. And the group is also the most vulnerable to having a problem with COVID-19. Respecting improving vitamin D status in the management of COVID-19. Patients with immune deficiencies who are detected with severe vitamin D deficiencies constitute a high-risk group, as I've said. Vitamin D is an important role in cardiovascular disease, diabetes, and also common in obesity patients. Vitamin D is fat soluble. If it goes into the body, it's stored in the fat, and it's released slowly. And that's why the number one risk factor for COVID-19 is age, and number 2 is obesity. And it's a fact too, because obese people just can't handle the vitamin D is stored in their fat. But also vitamin D supplementation for people of color. And that's why I talked about the cytokine storm. That's published in the Journal of Dermatology in 2020. Most of these articles you're saying were published in 2019, 2020. So it's hitting the scientific press now. The vitamin D inhibits the production of pro-inflammatory cytokine storm. There's about 400 natural units, 600, that's too low, as I'll show you in just a minute. We've been doing our own studies on that. We found out there's been a paradox in California. They call it the Latino paradox. And for years in LA County, they've noticed that the people have, if they're Latinos, they have much less all-cause mortality. You see along the bottom line there, Latinos, for years, but then the white line, you see, all of a sudden in 2019, it jumped way up, and now Latinos are having more deaths than people of light skin. Why? One reason, that's because of COVID-19. Why aren't we getting aware of this? I was asked to speak on the 14th of September to 17 members of Congress, members of the Senate and men of the House by Zoom, did it from Dallas. And these were members of the Physician Caucus. And have 17 minutes. I'm giving the same presentation I'm giving you I gave to them. And try to get this message out from the government standpoint. There's things that we can do that could maybe have an effect on the cost of health care, the number of deaths we're having around the world. It can be, but we're getting a foothold in this area. I tried to get this article published back in 2019 in the Dallas Medical Journal. Vitamin A company is there in relation. I couldn't get it published because I don't know why they didn't publish it. But again, you see it was picked up 3,531 places and went to 34 countries. So people are interested in that. I tried to get this published in 2020. All right, now look, doctors studying why obesity may be tied to serious COVID-19 infection. Obesity rate in the United States is now 42%. That's obese. That's above 30 on the BMI scale. But above 25 to 30, it's 70% what it is. Obesity rate is still higher among blacks and Hispanic. Is that one reason why they're having a greater problem with COVID-19? Another issue is chronic inflammation. I told you about that. Obesity, inactivity related to chronic inflammation. This is all coming to the forefront now. So we know that. And losing 13% of your body weight could lead to big improvements. I told the patients to come to me whatever weight, just lose 10%. I can guarantee some improvement to your health if you just lose 10%. I can live with that. And my enthusiasm about preventive medicine used to tell the patients to come in, they're overweight, inactive, smoking, drinking, all that. I want you to stop drinking, stop smoking, lose weight, start exercising. Never see them again. You get overwhelmed. So I thought you've got several major problems. I want to concentrate on one. I want you to start being physically active. Our studies indicate you're better off being fit and fat than skinny and unfit. So you start a step at a time. Why don't you get that message out to your club and members are members in your club. So just losing weight, look at some of the results, 13%. It's 8-year data on 50,000 people. Besides diabetes effect, losing 30% of their weight, made people 25% less likely to develop high blood pressure, sleep apnea. Weight loss also correlated 22% reduction, high cholesterol, 20% lower risk of osteoarthritis. So we know that. Addiction. People with tobacco use disorder are 8 times more likely to come down with COVID-19. You got a person who's overweight, people of color, smoking, and then even substance abuse disorder research also shows the same type of a problem. That again was published in 2020. Basically, review the preliminary evidence of COVID-19. This is published in Frontiers of Public Health. It pointed out that vitamin supplementation could tend to significantly more effective than 1,000. The higher you go, there's linked between vitamin D deficiency and COVID-19, as I mentioned. So they're recommending 2,000 units. You'll see why we're doing the same thing. Now, this was published just last year, 2020. In the JM, vitamin D deficiency, that's less than 20 of your vitamin D level, associated with 77% increased risk in COVID infection. It's kind of a curious, I can't see very well, but how many of you people have had your vitamin D level measured? Anybody in the audience had it measured? Yeah, a few have. You need to have that measured just like you need to have your cholesterol measured in your chest for blood sugar. Yeah, we measure that all of our patients. We have the vitamin D and the omega 3, we've done that for many years, as you'll see in just a minute. This is published in JMA, yet they're still not emphasizing that. Finally, after I couldn't get the article published in 2020, I had published in Dallas Morning News. They accepted it because of all the information coming up. Dr. Kenneth Cooper, vitamin D supplementation can help avoid COVID-19 infections. All right, then, this is why I said we have some knowledge in this area. We've been testing vitamin D since at least 2013, and we found out we have a total of 45,000 patients in this study. Now look what the average American, 2013, coming directly at a blood level of 32.8. Now, based on our population is roughly 94% light skin. About 6% of our patients are Afro-American or Hispanic. But our comparison, though, if you look at our longevity, what the white and versus what they call people of color, there's quite a difference there as far as longevity in America today. But my point is, these are basically white people that we have measured. But the vitamin D level, 2013 was 32. And then we started to encourage our patients to take a little product of our own called Cooper Complete Basic 1. That's 2,000 units of vitamin D, that's vitamin D3. So our physicians started recommending, take one of those tablets per day. They started doing that. Look what happened. We went from 32, 34, 35, 37, 38, 39, 39, and almost 42. So we're seeing results. We're proving that you can get it absorbed if you take it the way we're recommending. We tested almost 3,000 people to see how many had the antigen, which is the acute infection, and had the antibodies. And we found at the bottom there, the antigen, we had 36% of the people that had acute disease among the 3,000 we tested, 96 had antibodies. But we followed the 36 to see what happened. Not a single person was hospitalized, no deaths at all in that group. I've had some patient, one patient, he's African-American, had a vitamin D level of 70. He came down with COVID. It lasted only 3 days. So I can't guarantee high levels of vitamin D will protect you from coming down with COVID, but the facts are there. It markedly reduces the severity of the infection if you have a high vitamin D level as far as COVID-19 is concerned. So what do you need? Vitamin D, we know the deficiency level is less than 20, and 21 to 29 is insufficient. Normally, they say 30, we say that should be above 40, not just above 30. And the reason I'm saying that, this is a study now of some 1,700 people that we tested. Along the bottom there, you see the levels of vitamin D. And the vertical is the number that had antibodies. You saw it peaked around 20 to 30. It dropped off, and starting at 40, they were right straight down. I had my vitamin D tested last week, it was 68. And I take 7,000 units a day. And by doing that, we've been able to see some improvement in our patient. And we don't know yet, we don't know the numbers yet, but there are very few, if any of our people that have been on our study have come down with COVID-19, that are following our guidelines. This is a gene mutation, which can be a cause of vitamin D deficiencies. Individuals with this deficiency typically have a vitamin D levels in the single digit. And remember Barcet, we get above 9. And if you have this deficiency, don't have enough vitamin D receptors. It's probably one of the reasons here. If people be born with deficiency, absent vitamin D receptor. Ronald Goldstein won the Nobel Prize for identifying the LDL receptors years ago. And that's what propagated the use of statin drugs. We're having constant vitamin D, but vitamin D, like people can have deficient LDL receptors. Stormy Jones, with the girl they worked with, they had to have a liver transplant to get her LDL under control. She had cholesterol levels up in 400-500 or higher, but didn't have any receptors. And so it's the same thing with vitamin D. Some people are born without that. The only thing we can do with these people is have some infusion of vitamin D. We're looking at that now. So we're trying to look at this from a professional standpoint. Even Dr. Fauci is taking vitamin D. So I know this very quickly.